Have you ever experienced some bright red blood on your tissue after visiting the toilet or after a long call? Well, today we will be discussing that. My name is Benta. For the new visitors on our channel, I urge you to subscribe. We will be doing a topic known as hemorrhoids. Hemorrhoids, or also known as piles, are lumps that occur around or inside the anal area. They come as a result of constant irritation in the canal, which leads to weakening around that area. Hence, the veins inside thicken, therefore forming the lumps. The lumps can progress and protrude outside if not medically treated, although sometimes they tend to disappear on their own. Most common symptoms of hemorrhoids are: 1. You may experience itchy anus. 2. You may notice the red, bright blood on your tissue. 3. You may experience black stools. 4. You may get the urge to go or attend a long call even after having emptied your bowel just that moment. And the 5th one is pain during long calls or after long calls. People at risk of getting hemorrhoids or piles are: 1. Expectant mothers, because of the pressure exerted by babies on their abdomen, hence the constant irritation. And not also all mothers, but most. 2. People who lift heavy objects. Watu wa gym tunawaona sana. 3. People who take high levels of caffeine or caffeinated drinks like tea, a lot of alcohol. Nowadays there are a lot of energy drinks, so you also take care. People who are obese are also at the risk of getting hemorrhoids. And generally, everybody who gets constipation, you need to control that. Hemorrhoids have 4 stages. Those are the most commonly known stages. In the first stage, you tend to have blood after motion and slight pain. At this stage, it can dissolve on its own without medical intervention. In the second stage, the piles protrude after bowel movement and retract by themselves inside, and it's a bit painful. In the third stage, the piles protrude outside and they need your physical touch for them to go again inside. In the fourth stage, the piles protrude outside permanently and they need surgical procedures for them to be removed. It is advisable to see a doctor if you have increased blood after visiting the toilet. 2. If you tend to get dark stools, that means you're bleeding from inside. And 3. If the constipation is so bad that you don't get long calls. For the people in stage 1 and 2, the condition can disappear on its own, but if it doesn't, you can take over-the-counter drugs, which include creams, suppositories, some painkillers, and drugs that cure hemorrhoids. In most cases, for the doctors to diagnose the extension of your piles, they insert their fingers around your bottoms and feel how bad they are. And 2, they can decide to use a tool known as proctoscope to check the intensity of the piles inside your anal area. Surgical procedures have been reserved for the people in stage 4, whereby the doctor uses electrotherapy. He burns the piles using electricity. 2, he can decide to use a rubber, tie the piles around the area to prevent blood flow to them, hence shrinking them. He or she can decide also to use injection, whereby they drop the liquid inside the piles. To prevent you from getting attack of piles, 1, improve on your diet by taking a lot of water. Take all grain products like beans, lentils. Take a lot of foods high in fiber. Take fresh fruits and vegetables. And again, stop sitting on the toilet for so long because it exerts pressure on the anal area. You can also stop holding poop for long. That is, empty your bowels as fast as you can. And again, don't take foods high in caffeine and over-the-counter medications which contain codeine. I appreciate you guys for watching till the end of the video. If you find it educative, kindly like, share for others to benefit, and subscribe, and don't forget to turn on your notification bell so that you don't miss on our next episode. Thank you.